Arrhythmia, some important signs that cannot be ignored. High. In adults, normal resting heart rate is usually between 60 and 100 beats per minute, although there can be individual differences based on factors such as age, fitness level, and overall health. A normal heartbeat includes the following important characteristics. 1. Regularly. The interval between heartbeats is always regular, with a steady rhythm that is maintained over time. 2. Stable. Although activity intensity can be changed to a moderate degree, heart rate remains relatively stable, with little fluctuation compared to the resting state. 3. Pulse is clear and regular. The pulse can be easily felt in the wrist or neck. A strong and steady pulse shows effective blood circulation. 4. Appropriate changes in physical or mental activity status. The heartbeat must have reasonable adjustments, responding to changes in activity levels, emotions, or physiological needs. During exertion or emotional stress, the heart rate may temporarily increase to meet the body's increased need for oxygen. However, it will return to its normal resting rate once exertion or stress subsides. In general, a healthy heart rate represents a stable rhythm, appropriate pace, and ability to meet the body's needs. On the contrary, if your heart has problems for some reason, arrhythmia may appear, which is characterized by an irregular heartbeat. Arrhythmia occurs when the heart's electrical signals that regulate heart rhythm are disrupted, causing the heart to beat too fast, too slow, or erratically. Recognizing the signs and symptoms of arrhythmia is important for early detection and treatment. Here are some common signs that can signal the presence of an arrhythmia. 1. Palpitation. Palpitations is a medical term that refers to the feeling of the heart beating fast, fluttering, or beating in an unusual way. People with arrhythmia often experience palpitations, which can occur suddenly and feel like the heart is beating fast or skipping a beat. 2. Dizziness or lightheadedness. Arrhythmia can lead to insufficient blood flow to the brain, leading to dizziness or lightheadedness. These sensations may occur when standing up quickly or during exertion. 3. Fainting, sudden loss of consciousness. In some cases, arrhythmia can cause fainting spells, also known as syncope. Fainting occurs when an irregular heartbeat interrupts blood flow to the brain, leading to temporary loss of consciousness. 4. Difficulty breathing. Arrhythmia can reduce the body's ability to pump blood effectively to tissues, causing shortness of breath even during light physical activity or at rest. 5. Chest pain or discomfort. Although chest pain is often associated with heart attacks, arrhythmias can also cause chest discomfort or pain. The sensation can vary from mild pressure to sharp or squeezing pain and can occur during arrhythmia episodes. 6. Fatigue. People with arrhythmias may feel persistent fatigue or weakness due to reduced blood flow to vital organs and tissues. This fatigue may not improve with rest and can significantly affect daily activities. 7. Vibrating feeling in the chest. Some patients describe a fluttering or uncomfortable feeling in the chest during arrhythmia attacks. This feeling may be accompanied by palpitations and can be a warning sign of an irregular heartbeat. 8. Anxiety or panic. Arrhythmia attacks can cause feelings of anxiety or panic, especially when accompanied by palpitations, dizziness, or difficulty breathing. Furthermore, there is also the fact that the patient's own vague fear of sudden cardiac events can also contribute to increased anxiety levels. And 9. Sudden cardiac arrest. In severe cases, untreated arrhythmias can lead to sudden cardiac arrest, a life-threatening condition characterized by a sudden loss of heart function. Sudden cardiac arrest requires immediate medical intervention, including cardiopulmonary resuscitation, CPR, and defibrillation. However, you also need to note that, even if you see the presence of one or more of the above symptoms, it is not certain that it is arrhythmia. Because those symptoms are not only related to arrhythmia but can also be related to other medical conditions, which may or may not be related to the heart. So if you experience any of these symptoms, including recurring palpitations, fainting, or chest pain, whether or not you think you have an arrhythmia, you should see your doctor immediately. Early diagnosis and treatment of arrhythmias can help prevent complications and improve long-term outcomes. Here are some examples of conditions that timely management of arrhythmias can help prevent. 1. Stroke. Some types of arrhythmias, such as atrial fibrillation, AFib, can increase the risk of blood clots in the heart. If the blood clot dislodges and moves to the brain, it can cause a stroke. Early treatment of arrhythmias, especially with drugs to control heart rate and blood thinners to prevent blood clots, can significantly reduce the risk of stroke. 2. Heart failure. Chronic arrhythmias can weaken the heart muscle over time, leading to heart failure. Heart failure occurs when the heart cannot pump enough blood to meet the body's needs. By promptly and effectively controlling arrhythmias, the risk of developing heart failure can be minimized. 3. Cardiac arrest. Serious arrhythmias, such as ventricular fibrillation, can lead to sudden, life-threatening cardiac arrest. Prompt treatment of arrhythmias, including the use of an implantable Cardioverter-Defibrillator, ICD, and other interventions, can prevent sudden cardiac arrest and related complications. 4. Myocardial infarction, heart attack. Some arrhythmias, such as ventricular tachycardia, can increase the risk of heart attack by affecting blood flow to the heart muscle. Prompt diagnosis and management of arrhythmias can help reduce the risk of heart attacks and their consequences. 5. Reduced quality of life. Arrhythmias can significantly affect a person's quality of life by causing symptoms such as palpitations, dizziness, fatigue, and shortness of breath. Early identification and treatment of arrhythmias can alleviate these symptoms and improve overall health. And 6. Death. Untreated or poorly managed arrhythmias can increase the risk of premature death, especially in people with underlying heart disease or other risk factors. Effective treatment strategies, including medications, lifestyle modifications, and in some cases, invasive procedures, can help reduce arrhythmia-related mortality. In short, to be able to detect an arrhythmia early and avoid major, unpredictable, and difficult to overcome consequences, you must always be careful to preserve your health and quickly consult a doctor in the event of having a problem as above. Only diagnosis carried out by doctors in medical institutions equipped with all the necessary equipment can draw accurate conclusions about this disease. Good healthy. Thank you, goodbye and see you again.